Opioids are medications that originate from the opium poppy and are known for its ability to relieve pain and alter mood. There are many types of opioids. Most are known for their medicinal purposes. Some of the popular mild opioids include codeine, hydrocodone, and oxycodone. Some of the more major opioids are morphine, hydromorphone, phenylene, and methadone. And finally, heroin, which is derived from morphine. The cultivation of opium began in Europe and in the poppy fields of Spain, Greece, and Egypt. It is believed that the fossilized poppy seed cakes and poppy pods in which the opium is extracted from dates back to the Neolithic era. The opium in its crude form was cherished for its mood-elevating properties. During the 1500s, a Swiss physician and alchemist decided to mix opium with wine to create a more powerful and potent medication that he called laudanum. It wasn't until the 17th century that the substance was standardized by Thomas Sydenham, an English physician, and promoted as beneficial to health. Laudanum was sold without a prescription worldwide up until the early 20th century. This medication was mostly known for helping to relieve pain, emotional distress, diarrhea, and what was then known as women's disease. Laudanum was even often recommended for irritable babies to help them sleep. In 1804, a German pharmacist discovered that opium had many different alkaloids, and it is by isolating each of those components that he discovered what is now known as morphine. Its ability to be soluble in water made it readily injectable and fast-active to relieve severe pain. In the late 19th century, Bayer, the German drug company, discovered another alkaloid from crude opium. They claimed that this new chemical was more effective and less addictive than morphine. They called their new discovery heroin. Heroin became widely used for everything from the pains of infantile teething and asthma and to the aches of rheumatism, and often advertised as a sedative for coughs. During the early 20th century, the levels of drug dependency became apparent and scientific studies highlighted the potential negative effects of opioids. Laws were eventually established to control and restrict the sales of narcotics and opiates.
Heroin is the leading illicit opioid. However, in 2006, only 1.6% of adults in the United States said they had used heroin in their lifetime. Heroin was first derived from morphine in 1874 and is approximately 3 times more potent. The composition of heroin only differs from morphine in that it is more fat-soluble and therefore can be easily snorted and absorbed through the mucous lining of the nose. However, this is the practice that is usually used by people starting out their drug use. As these new users develop tolerance, they often move towards intravenous use. They usually begin by skin popping, a method in which the user injects heroin just beneath the skin. When injecting in large doses, the user is at great risk of developing heroin dependency. Many users report that they begin to feel withdrawal effects approximately 6 to 8 hours after injecting. This puts the user on a schedule of injection of 3 to 4 times per day in order to avoid withdrawal. This practice costs the user anywhere from $30 to $100 a day. The procedure for illicit using involves mixing the heroin powder with water on a spoon, heating the substance to help it dissolve, and then drying the substance into a syringe through cotton and injecting. Injection is usually done into the forearm, but as users' veins collapse, they will use other locations of the body. Due to the low rate of sterility in this practice, infection, hepatitis, tetanus, and abscesses are quite common. Although the intent of medical opioids is to be given by prescription as a means of helping the patient, it is not uncommon for people to abuse them. In 2006, it was estimated that 5% of Americans over the age of 12 had abused prescription pain relievers in the past year. Some patients using opioids to treat their pain become dependent upon them, and others simply seek these opioids for recreational use. Medical opioids such as codeine, hydrocodone, and methadone are obtained illicitly or through prescriptions. When being abused, the pills obtained are commonly grinded up and injected by the user. The risk here is that other components of the pills do not fully dissolve as heroin does. This results in the particles being injected into the user's blood vessels, which can cause irritation, vascular inflammation, and blockage of blood supply to different areas of the body. Many investigations of opioid dependency have failed to determine a particular pattern of use in regards to who uses opioids. However, in the early years of opioids, it seemed as though the typical user was a middle-aged woman in the middle class. Usually these women took opioids orally. More recently, there has been a shift, and it seems as though young males of the lower class are choosing to inject heroin more commonly. This shift may be connected to the high number of men who became dependent upon opioids during the Vietnam War. However, researchers are not sure of this, as it did seem that many of these soldiers were no longer dependent upon returning home at the end of the war.
Common effects of opioid use include a pleasurable and dreamlike euphoric state, reduced sensitivity to pain, constricted pupils, and drowsiness. Side effects of opioid use can consist of constipation, difficulty urinating, nausea, vomiting, and slowed breathing. Users going through withdrawal may experience watery eyes, runny nose, yawning, and sweating. As withdrawal continues, users may experience other unpleasant effects such as restlessness, irritability, loss of appetite, shivering, cramps, and increased sensitivity to pain.
Feel like come down yet?
Yeah.
Stop right there. Think you need to see medical or something?
I ain't gonna do nothing for me anyway.
No? All right, go ahead and step in here for real quick.
I had a great life. I had a great job, great family. I was engaged when I wasn't using. And then these past 2.5, 3 years just been the worst. I've lost everything. Everything in life. These marks here are all old. You see all these little marks right here on my hand? I mean, you can't see any veins in my arms or hands. See, these marks, all these right here, these are all old. All these ones are all new. All the way up here, on this leg, down this leg here, all my whole legs, everything. Those are the new ones. It's pretty bad addiction. I don't even get high anymore. I just do it so I can feel normal. I'm starting to get withdrawals, and it's starting to take effect now since I haven't used in almost 12 hours. You start getting cold, cold, hot, cold, hot. You start sneezing a lot, nose starts running, vomiting. You can't get comfortable. Imagine being physically sick with the flu, just where you don't want to move. Your bones ache, your body aches, your stomach hurts. You just feel like throwing up. You just drained of everything physically. And that's what I'm gonna start going through. I'm scared, and let's be honest.
Effects of an opioid overdose include slow and shallow breathing, clammy skin, convulsions, coma, and possibly death. There are several common causes of overdose amongst opioid users. Autopsies typically reveal the cause of death of opioid overdose is respiratory arrest. It is estimated that the annual mortality rate amongst opioid users is approximately 1.2 to 2.7%, while 45 to 68% of addicts survive at least one overdose during the course of their addiction. Loss of tolerance generally occurs with heroin addicts after a period of reduced use, such as when a user has been in prison or an extended rehabilitation program. Abstinence from the drug creates one's tolerance to drug. Upon using again, many users will attempt to inject the same amount their body could once handle. In addition, the purity of street heroin can vary drastically, so a user may inject more or less than they were expecting. Another cause of overdose may be conditioned response. Studies done by pharmacologists have shown that animals can be given a gradually higher dose of heroin if they are always in the same room. If they are moved to an unfamiliar space, the same high dose could kill them. In other words, it is thought that the conditioned response permits a user's body to anticipate the dose. Experienced opioid users who have overdosed are often discovered in unfamiliar environments. Many users also combine opioids with other substances such as anti-anxiety medications or alcohol. Both of these drugs are depressants, and with the depressive respiratory effects of opioids, this can be a fatal combination. Other common factors of overdose can include liver disease, lung disease, smoking, and infection.
Opiates mimic the actions of a related family of chemicals broadly known as opioid peptides, which are naturally present in the brain and spinal cord. Opioid peptides are grouped into three categories: enkephalines, endorphins, and dynorphins. Opioid peptides are often many times more potent than narcotics, such as beta-endorphin, which is thought to be 200 times as potent and analgesic as morphine. The function of these opioid peptides has shown to include perceptions of pain, moderation of emotions, perceptions of anxiety, sedation, appetite suppression, anticonvulsant activity within the brain, smooth muscle motility, regulation of body functions such as temperature, heart rate, respiration, and blood pressure, and may even include perceptions of pleasure. Narcotics utilize the same receptor sites as naturally occurring neurotransmitters, the opioid peptides. One of the areas of the brain narcotics appear to work is in the medial portion of the thalamus, where they are thought to mimic the opioid peptides normally found in that region, controlling the perception of pain. Another region of the brain where narcotics seem to take effect is in the ventral tegmental. This region of the brain uses dopamine as a major neurotransmitter and connects the cortex of the brain with the limbic system. Narcotics' effects on this region are thought to produce the feeling of euphoria often reported by opioid abusers. Narcotics can be absorbed into the body from injection sites, either intramuscular or intravenous. They can also be absorbed through mucous membranes such as rectal suppositories or nasal. According to the World Health Organization, opioid dependence is not just a heavy use of opioids, but a complex health condition that has social, psychological, and biological determinants and consequences, including changes in the brain. The key elements of opioid dependence are a strong desire or sense of compulsion to take opioids, difficulties in controlling opioid-taking behavior, a withdrawal state when opioid use is ceased or reduced, evidence of tolerance such as increased doses that are required to achieve effects originally produced by lower doses, progressive neglect of alternative pleasures or interests, and persistence with opioid use despite clear evidence of overtly harmful consequences. These aspects that make opioid dependence particularly damaging to the individual, family, and community.
Treatment for opioid addiction include psychosocial therapy and pharmacotherapy. Psychosocial therapy refers to programs such as self-help groups like Narcotics Anonymous, which provide social support and resources that reinforce positive behavioral changes. Since opioid addiction is rarely managed through psychosocial therapy alone, pharmacotherapy aims to use a replacement drug in order to reduce withdrawal symptoms, as well as a desire to use opioids. Methadone is the most common opioid replacement therapy. However, because of the strict regulation of its distribution by care centers, many addicts have limited access. Two other more recent pharmaceutical treatment include buprenorphine and naloxone. These pharmacotherapy methods allow addicts to gain a better quality of life while avoiding the severity of withdrawal symptoms. Although services exist, there are barriers to getting help. Common barriers include stigmatization from physicians and nurses, self-stigmatization, discrimination, frequent need for services, fear and anxiety about withdrawal, and a lack of professional skill in identifying and addressing substance abuse.